Hello to everybody. I want to thank the International Society of Prenatal Diagnosis. This is a pregnant woman from Venezuela, 21 years old. She arrived to the emergency room referring uterine contractions, and she had a blood group A and a Rh factor negative. We requested blood samples, urine samples, and obstetric ultrasound. During the obstetric ultrasound, we found free fluid around liver, as we can see here, and in the sagittal plane, more free fluid around the gut, suggesting fetal ascites. So our first option was an alloimmunization because the blood type of the mother. But with all the results, we had serological test positive for syphilis, 1 in 128 dilutions positive for BDRL. So it was a maternal infection and a congenital syphilis infection. So we have to measure the median cerebral artery, trying to find maybe fetal anemia, and we found a peak systolic velocity of 68 centimeters per second. For 30 weeks of gestation, it was more. It was 1.63 multiples of median. And the next step was to intravascular intrauterine transfusion. So we had a donor, blood type O, Rh negative. The hemoconcentration was 68%. Before the transfusion, we did a cortosynthesis, and in the first 1 milliliter, we obtained a negative indirect Coombs test and an initial fetal hematocrit of 26%, a baby with a blood type A, a Rh positive. The final fetal hematocrit we wanted to get was 45%. And with a baby, the weight of the baby was 1,500, and we need to transfuse 47 milliliters. The same results with calculators of the Clinic of Barcelona. Okay, this is the procedure, the patient, this is me, the other doctors, and this is the placenta, the heart, this is the gauge, amniotic fluid, the umbilical cord over here. Interesting because we had this fetal monitoring before transfusion. We had a baby before transfusion. We had a baby with reduced movement and with this non-reactive fetal monitoring, without variability, without accelerations. But after penicillin treatment, the first dose of penicillin treatment and intrauterine transfusion, this was the monitoring, so totally different. 5 days after the procedure, we measured the medium cerebral artery, and the results were 56 centimeters per second, was much better of the first. And unfortunately, 10 days after the procedure, the mother had a premature rupture of membranes. We did a cesarean section because the baby had a breech position, and the female, we obtained a female, 1,600, Apgar 8, 9. The hematocrit of the newborn, 38%, was good. The baby had a blood type A, a Rh positive, and direct Coombs negative, of course. And during the lumbar puncture, they obtained positive. So the baby had neurosyphilis, so received 10 days of penicillin treatment. And this is the baby, the great baby, and the results were the best. And this is my hospital, this is my team. I want to thank to everybody, and of course to the International Society of Prenatal Diagnosis for this opportunity. Thank you very much.